rehabilitation. We understand that many of our people, Ukrainians, are facing the need of rehabilitation. This is why we are going to discuss the improvement of the system of rehabilitation with Tetiana Lomakina, the um, Commissioner on BarrierFree Environment of the President of Ukraine. Let us hear more about rehabilitation. I'd like to mention that right now some systemic measures are being implemented in order to improve the system of rehabilitation from the trauma of war and improve the rehabilitation of people. This initiative of barrier-free uh, approach was introduced 2 years ago by the First Lady, and right now this initiative is becoming increasingly important. We understand that with each coming day, more people are getting injured, and because of that, they will need to be restored. It's important that Ukraine is following the international standards in this, and thanks to the work that has been implemented already, the international classification of functioning is being introduced. We are not looking at the person from the standpoint of their condition, but rather from the standpoint of their potential and their needs, the things we need to do to help the person. And also what's being introduced right now, a person will be working with a multidisciplinary team to ensure active rehabilitation. In the previous systems, the person had to follow the prescription of the doctors. They had to follow the procedures and let's say the massage or the electric treatment, but we understood that the world was going further, and right now the person is also need to act actively, taking part in this process of treatment. The person is not only the recipient of the medicines, it is helping the rehabilitation team. For instance, a person with partial limitations of eyesight, we can help them to live on, but does the person want to do that? Is the person ready to live in this condition? So the psychologists help the person, help the person with spatial awareness, also the person is being assisted to make arrangements at home to make the space comfortable. Also, people are working to help the person with the communication with some additional tools such as eyeglasses, lenses, additional devices for the mobile phone for the person to be able to better adapt to their new condition. So this is a comprehensive approach of the multidisciplinary team, but it is also assisted by the efforts of the person. And this only can entail considerable result. And we are also pleased to see that there are hospitals that have started introducing this approach. And here I'd like to mention that the introduction of ICF is gaining more traction thanks to the support of the Ministry of Health and also the Swedish agency of development and cooperation, and also thanks to the civil society organizations such as the Patients of Ukraine, the School of Rehabilitation Medicines of Ukrainian Catholic University, the ICF trainers. We are working right now to make sure that ICF becomes a working tool for every healthcare professional in Ukraine. And for this, we are establishing a model in the e-health system where every doctor will be able to use it. The second step is training the doctors on how to use ICF and to use this important model in the system. And one more important step, we have selected 4 healthcare facilities which are already providing quality services as of today, and thanks to this support they are going to develop their services and also be used as centers of excellence. They will be providing training to other healthcare institutions. So Lviv emergency hospital, also the St. Panteleimon Hospital in Sumy, the hospital number 4, and in Rivne, the regional veterans hospital. So these rehabilitation teams will get additional training. They will get additional equipment where it is necessary for successful rehabilitation of the patients, and also they will not only improve their own skills, they will be able to pass the knowledge on. And when is this model going to start work, and what services are going to be available? Well, this is a working tool for the doctors. We are expecting it to start its separation by the end of the year. Right now, it's the programmers doing their job, but we are not losing this time. We are using this time to train the doctors to use ICF and also to train them using the model. And what is the assessment of the government about the number of people in need of rehabilitation? Well, that's a difficult question because we do see injuries on a daily basis, and especially when it's happening in the active combat operations zone or in the temporarily occupied areas, it's really difficult to track, but we can surely tell that the numbers are growing. We have some online questions. The first one is about injured children. We unfortunately have many of those because of the military aggression. Some people need rehabilitation, some people need prosthetic limbs, etc. So is there such opportunity to manage the case of a child for a long time? There are 2 possible pathways that the parents are following these days. First way is to do this in Ukraine with Ukrainian specialists, and right now in the Ahmadid hospital there is the acute rehabilitation department, which has already introduced the systems and models of modern rehabilitation. Another way is for parents to take part in international programs, and with the Ministry of Health, they are selecting a program and leaving for rehabilitation in a different country. It is the decision of the parents, but right now the system is being established here in Ukraine. So the changes also require some changes in the legislation. What kinds of changes are being planned to improve the rehabilitation system, and are there any plans to minimize the bureaucratic processes? You are right that before launching this project, it's very important to have it discussed with all the ministries involved, the Ministry of Veterans, the Ministry of Health, Ministry of Social Policy, and Ministry of Defense. Indeed, the analysis of the legislation is planned in order to reduce the unnecessary actions for the patient, to simplify the procedures, and to make sure that once the person gets their assessment according to ICF, they immediately get their roadmaps with all the necessary steps made ready for them. It's going to be introduced since next year, also making sure that the social payments, the pension, etc., all of this is included in the model. And this year we want to remove the necessity for the person to directly communicate with the medical commission and for the doctors to be able to make all the necessary decisions. Well, our combatants who need rehabilitation will benefit from these changes. Well, actually, every person in need of rehabilitation will see the effect, and this is a change of approach, the change of how we are helping the persons to recover. And no matter where the person is seeking help, the same approaches should be used. And the next important step for Ukraine is the development of community-based rehabilitation. This is a system of support, something we discussed in the beginning. The person is being recovered, and the person has already received help in the hospital. Now they are getting back to their community, so they probably need the consultations of the psychologist, of the specialists who will help to make arrangements at home, and other social services as well. This is the next step. And now, dear colleagues, if you have any questions, you can ask them. I see no questions in the room. Thank you so much. This was Tetiana Lomakina, the Commissioner of the President of Ukraine on Barrier-Free Environment. Stay with us, follow our schedules for tomorrow. It will be ready quite soon. Follow us and stay with us.